Welcome to the Health Coach Impact Podcast. It's brought to you by HCANZA, the Professional Association for Health Coaches in Australia and New Zealand. I'm Sharon Curtain, a dietitian, a health coach, a board member of HCANZA and a director of Accredited Health Coaching Australia. And in this episode, I'm joined by Ben Harris, who's the Director of Policy and Research for Private Healthcare Australia. And we're going to be talking about where health coaching fits in that private healthcare space. So welcome, Ben. Thank you so much.
Thanks, Sharon. Great to be here.
It would be really great, Ben, if you could tell us a little bit more about you.
Of course. So I'm Ben Harris. I'm the Director of Policy and Research at Private Healthcare Australia. We're the peak body for health insurers. So our members include La Trobe Health, NIB, Medibank, Bupa, HBF, and a whole range of health funds across the country, which cover 99% of the 15 million people with private health insurance. I'm an economist by training. It's a while since I've actually worked as an economist, but I've worked in government and I've worked in not-for-profits, and I've also done a bit of work in the university sector.
Such a breadth of experience. I'm really curious, if you had to sort of sum up or give us an overview of private healthcare in Australia, what would you say?
Private healthcare is actually the dominant form of healthcare in Australia. People pay for all sorts of things with private health, whether it's a general practitioner or private health insurance or some of the things we think about there. But also we have a very significant system in Australia of allied health professionals, health coaches, pharmacy, the non-regulated pharmaceuticals. People actually spend a lot of their private money on healthcare in Australia. It's actually a bit more than most OECD countries, but our mixed system has actually done a wonderful job making sure that we have access to things that people want and need, but also making sure that we end up with a great deal of choice, because one of the really, really important things about health, which I know your members care about deeply, is it's not one size fits all. People are different. And people need different things to reach the same results.
And we've got a fantastic public health system. You know, if you're sick,
Absolutely,
have an accident, we've just got this amazing health system, but the public health system by itself can't support what people need.
That's right. And we often think about health as being, hospitals or surgery or accident and emergency. And all of those are really, really important. I know a lot of doctors, and I'm very, very happy to know them. I don't want to meet them professionally. You're better off not being involved with the health system. It's like health insurance. When people say, I don't get value from my health insurance, I say, well, we can get a cricket bat, fix that for you. But you don't worry about not using your fire insurance. We've got a wonderful system, but we do spend a bit too much time relying on using that system rather than making sure people have got the skills and what they need internally to avoid healthcare as we understand it. But that is actually healthcare. It's prevention. It's managing chronic conditions. It's eating well. It's exercising well. And all of those things are actually a really important part of our health system.
You are singing from the same hymn book to health coaches, Ben. So, HCANZA, we're the professional body that represents accredited health coaches both in Australia and New Zealand. And, we know that health coaching is the missing link in the health system. We've got, as you said, people with the chronic conditions. We need more support in the area of preventative health. And this is really where health coaches shine.
Absolutely. Our health system was designed in the 1960s and early 1970s, and it's really good for what it does, which is acute care, making sure if something goes wrong, you can get it fixed. And that worked in the 1970s. But we've got this sort of interesting dynamic now where people are living with health conditions rather than dying from them. Now, that's great. We can actually live longer. We can have a much more active life well into our 80s for a lot of people. But people in their 40s and 50s end up with health conditions as well. But our health system was designed for acute care. We are now living in a chronic world, and we're living in a world where we want people to be participating as much as possible, and people want to be participating, whether it's study, whether it's work, whether it's caring for grandkids, whether it's community engagement. But we really need to make sure that our health system actually does health rather than just illness or disease.
Oh, yes, we do. Um, so where do you see health coaching sitting in the health system as it is, and where possibly it could go?
I'll go with the as it is, and then I'll talk about what our health system could and should look like to be able to use the skills of health coaches. So we have this sort of inverted pyramid at the moment where there's 25 million people across the country, or 27 or whatever it is. Most of them never see a hospital. It's less than 1 million people a year who end up in a hospital. Yet that's where most of the money goes. Money goes into this tiny little group of people who need intensive healthcare. And it's a really, really expensive way to do things. So health technology has increased. We can spend an astonishing amount of money on healthcare, and healthcare is actually becoming less efficient. We are spending more money to get the same results. Now, some of that is a bit of swings and roundabouts. Some of it is actually keeping people alive for longer, keeping people more active for longer. But it's a very, very expensive thing to do. And we see, state and territory governments all the time worrying about funding. We see emergency departments which are full of people. We see public waiting lists. Luckily, with private health, the waiting lists aren't anywhere near the public system. But that does rely on paying premiums, and it does rely on having some money. You can get emergency care, you can get the care you need in the public system if you're prepared to wait for it. But it is an expensive thing to do. And that means that money gets sucked into this more and more acute bit of the health system right at the pointy end. It means money is just going from governments into those really tough areas which are getting more and more expensive. So prevention is woefully underfunded in Australia, and if you take a wide view of prevention, then it's people who, aren't seeing campaigns on bus shelters, that old-fashioned broadcast of, hey, you should stop smoking. We don't invest in narrowcast messages for groups of people, and we don't invest in a whole heap of things we know well to give people information so they can look after their own health. So when you've got something which pays off well into the future, or frankly, what generally happens is that it reduces the growth in demand well into the future, you still don't save money, then the urgent overtakes the important. And our health system is designed to, and plenty of vested interests are talking about crises all the time, and so that sucks all the money in. But it's not the right investment in what people actually want. As I said, people don't want to go to hospital. It's a really awful place to be. Might be the least worst place to be, but it's not something that people should or would aspire to. So health coaches are at the moment in that bucket of supporting people to make their own choices to make them better. It's not work which is super urgent. If you see someone today or you see them tomorrow, it doesn't really make a difference. If you're lying in the street waiting for an ambulance, it absolutely makes a difference whether it's today or tomorrow. So that's where the money goes, into that really acute part of the system. And it's sucking up more and more and more, and we're investing a lot less in of the government money in things that need to be done, which are really important. So health coaches still have a really important place in the market because people know they want to be healthy, and there's a large group in our community who can afford to come and see someone privately. And health coaching is still needs to be better understood by a lot of people to understand what it is they can do. But there's a whole heap of prevention and management which is done in the community already, which people pay for, whether it's taking supplements, whether they work or not, whether they go to the gym, whether they eat well, whether they invest in food and exercise. But health is really complicated, and most people do not have the knowledge to be able to learn enough about their own health in the time they have available. So that's where health coaches, I think, are going to be, absolutely the way of the future. Whether it's a concierge who can help you manage your chronic disease, whether it's someone who's more on the prevention side, who a dietitian or a nutritionist who can actually say, well, you might think you want to be eating that way, but here's another thing you can do. Exercise physiologists, people who can work with individuals and actually get good results. So, a coach, a mentor, a guide, someone who can help me or any patient or any customer, client, whatever language you wish to use, any person, to be as healthy as they can be. And it's something we don't invest a lot in across the system at the moment. And I think HCANZA has only got a few hundred members. I want you to have thousands. I want health coaches everywhere.
Yeah, so do we. And I think that analogy of the broken bridge at the top of a waterfall that has people falling, and then you set up camp at the bottom of the waterfall because so many people are falling, and then you end up setting up hospitals at the bottom of the waterfall, and no one goes up because there's no one free to go to the top of the hill and work out why is everyone falling off into the waterfall and getting injured. And then, and that's hard because you have to take something away from the people at the bottom who are the urgent ones, who are, in the ambulance in the street, in order to send people upstream. And that's a hard decision to make. So you're going to make a huge difference.
Like a knee replacement costs $25,000. And it's really hard to say to someone who's in a lot of pain, sorry, we're not doing that. We're going to invest upstream. We're going to invest in prevention. We're going to help you manage things. Yet we also know that there's a lot of waste in our system. One of the things which a lot of people don't really think about in health in Australia is we have a fee-for-service system. So you go to the doctor, you get paid. You go to a surgeon, you get paid. You go to a physio, and there's payment. But what consumers want is no service. They don't want to need that service. But when you've got a fee-for-service approach, it means that people are subconsciously incentivised to intervene and to do a thing. People don't get paid when someone's well. People don't get paid not to have a knee replacement. And when there's a lot of money on the table for a knee replacement, for example, it's really hard to say, hey, maybe you should do a little bit of physio, maybe you should do a bit of exercise. Have you thought about dealing with diet or with some of those mental health issues that contribute? And it's complicated. And, hey, I'd prefer to take a pill and make everything better. That sounds great. But a lot of good healthcare actually requires a bit of knowledge and a bit of hard work. And we've conditioned patients to look for a quick fix because that's how people get paid. That thing around doing the work, whether it's mental, whether it's physical, whether it's learning how to do things, it's complicated. and it's hard. And it's a lot easier to just sort of say, oh, it's all a bit hard, and I know there's a good health system if I get sick. Now, people don't think about it that way, but it is subconscious. We know that we've got a system which will look after us, and we do have a pretty good safety net. But we also know that most people want to be healthy. Most people want to manage their chronic health conditions. Most people want to be able to participate in life in whichever way they choose. And that's where health coaching, better information, which is tailored to individuals, has got a massive place in our community, but our health system hasn't caught up with that yet because it's still based on the acute model.
So some of the private health insurances do have health coaching programs.
Absolutely. And, we actually have a number of our health fund members who employ health coaches or people who are in health coaching roles. And I'm sure we'll come to how we recognise people as health coaches at some stage too. But it's really, really important. And whether it's, as I said, in a concierge role of, oh, you've got a really difficult health condition and there's a whole lot going on, health funds do have programs which help people manage all of that and in a concierge role. Then you've got people who are employed by health funds for particular programs, whether it's sort of diet and exercise, a lot of it's about weight, a lot's in the mental health space. As those are two areas which are really difficult for a lot of people. But we've also got a few funds who actually pay for health coaching out in the community. But one of the issues we have there is that trying to work out who's a health coach and who isn't is quite difficult. But because a lot of, you've got another qualification as well as health coaching. When I went to the HCANZA conference in Brisbane, which was a lot of fun, nearly everyone there had a different qualification and moved into health coaching. But that's not strictly necessary. What you need is someone who's got got the mindset around helping people and the skills to provide coaching and to make sure that people can get the services they need, even if the individual practitioner isn't providing them themselves. But look, I'd like a lot more people to employ health coaches. I think make a huge difference to a lot of people.
So, private health insurers, from my understanding, will invest in something that's going to save them money.
To a point, if I'm being facetious a lot of the time, I say we don't do things because we're nice, we do things because our auditors tell us to. And if you can invest in a good prevention program and delay a knee reconstruction, delay a mental health admission, then that's good for the consumer, good for our customer, but also good for our bottom line. The trick, of course, is finding the right people and the right interventions. And we do invest a fair bit in prevention, but we also have that same issue governments have. We have to pay for the urgent stuff. And there's a whole heap of laws. We are so tightly regulated. We have to pay for healthcare, which is done in the hospital with a doctor, regardless of how good it is, frankly. So we pay for a lot of what we call low value care, which is, bad care. And that sucks up a lot of money. So trying to shake the money out into prevention is actually really difficult. And a lot of time at conferences, I ask people to put their hands up if they'd like to pay more for their private health insurance premiums. And I don't get many hands. So it's something that, consumers, sort of want in the abstract, but a lot of the time they're not prepared to put their hand in their pocket to pay for it. And that goes for community health coaching as well. But again, we're, at the bottom of the cliff. trying to pay for a whole heap of things that we know would be better off if we were up the top. And, occasionally we get stuff up there, but we do spend the vast majority of our money on acute care in private hospitals.
Yeah. So I'm guessing that if they've invested in health coaching, it's worth their while because those programs must, as you said, delay progression into things that are going to cost them a significant amount of money if they do then make a claim.
Yeah, look, a lot of the time, yes. Sometimes it's, we think this will work, let's give it a go.
Okay.
And that's one of the big things with prevention. Like, I used to work in government, and every time you'd go to Treasury and say, oh, we'd like to invest in this prevention program, and say, well, that's great, but you're still asking for an extra 3 to 5% a year. And said, yeah, and this will stop it being 4 to 6%. Well, so, it might shift the demand curve, it might not. What we don't have is, really strong data on if you do X, then Y will happen. What we can do is look back and say, hey, that worked. So bringing the rates of smoking down in the community has saved us a fortune on, and the return on investment in that has been demonstrated to be really, really good. We didn't know that when we started anti-smoking campaigns in the 1970s. There was a hope, a guess, some modelling. Likewise, if we sort of see, obesity as a correlated with knee reconstructions, with bariatric surgery and a range of other health conditions, so metabolic and muscular, then we know that if we can cut that by 1%, we'll save a lot of money. We don't know which 1% and we don't know what the interventions look like. Now, we've got pretty good ideas of what might work, and there's better data coming out on that all the time. But people are different. They work in different ways, and programs which rely on let's do X and hopefully get Y got a fairly patchy record. And this is where I think health coaches are really going to step in, because they're going to, instead of, something which says, hey, Ben should eat this, this and this because he's a 55-year-old male and he's, 92 kilos and 6'3". Health coaches can actually work with me and actually do something which I can do. So instead of saying, Ben, you should, give up smoking, I'll say, I've never smoked in my life. Thanks, really appreciate that advice. But also, if it's around diet, for example, what is it? What are my barriers? Is it financial? Is it time? Is it psychological? Is it, and health coaches can actually work out what's happening in individuals' lives and sort of start narrowing the objections, or making sure that you get to the nub of the issue rather than just sort of spraying something and hoping it works. So, I think there's a lot of IT help which can be done here, but also that human touch and someone who actually invests time and energy in understanding me and my circumstances, rather than just telling me, oh, we've got a program for that.
Yeah, and you know what, I think when health coaching programs are really, really effective, it's when the people who are in those programs aren't just delivering information. They're not just having, and you need to move more. Week 1, and you need to eat healthy. You need to eat more vegetables. Week 2, and, week 3. Are you sleeping enough? You need to prioritize sleep. All of those shoulds and all of those you need to, they're already out there. What people need is to, like you said, that personalized, well, what does that mean for me? And I actually don't like vegetables. What do you mean you don't like vegetables? Tell me about that. Oh, they're tasteless and they're overcooked, and they're thinking of, Brussels sprouts or the broccoli that their mum boiled to death. So that's where you've got the mindset. You've got to uncover those barriers. And current healthcare, you go to your GP, most GPs just say, this is what you need to do. And I love GPs. I've got some amazing GPs. But the GPs who come and learn the health coaching, their minds are blown.
The GPs get 6 or 15 minutes with somebody, and a health coach spends longer. But you're right, it's that sort of, okay, so what's my perception? What is it I'm hearing that I need to do, and what is it that I actually need to do? And some of it is really basic stuff, whether, so to take eating, for example, you need to eat differently as a 25-year-old as a 55-year-old. One of the scariest things I ever heard, and I'm still not convinced whether it's true, is you need to cut 500 calories a year to stay at the same weight after 50. Well, it's obviously not 500 a year that'll take you down to zero pretty quickly. Eating less, you need to eat less. You need to change the balance. And one of the things that I'm finding really interesting at the moment is, as I sort of get into my stage of life, is, my needs are changing. My capacity to do things is changing. Like, I'm going to be fitter and stronger at 60 than I was at 50. But that's going to take a really different amount of work than it did between 40 and 50. And going back to where the demand comes from, there are a lot of people who really want to be fitter and they want to be healthier, and they're just lacking some of the information. That information's available, but you've got to sort through a whole heap of crap to get to it. But is it relevant for me? Will it work for me? And will it work for my lifestyle? And, for men in particular, as we go through this stage, it's sort of a linear thing. And for women, there's the perimenopause and menopause stuff which comes in as well, which actually shifts a lot of this stuff. And a lot of what we do in health is absolutely based on a male model. Now, one of the things I often repeat is that half of the drugs that were used in the United States in the 1980s have never been tested on women. Now, I'm not a doctor, but I have noticed a few differences here and there. But we need things which are designed for people where they are, not some ideal model of, where some medical research has, excluded various people or so on. And as you sort of go through those barriers as health coaches try and work out what my perceptions are, they also can uncover a whole range of things which make things really difficult. So, the sandwich generation, people are looking after both kids and parents. That wonderful time of life where you speak to your kids and your parents in the same tone of voice. Trying to manage crises within the family, we're trying to ensure you've got safety and security. All of those things are really, really important for how people can take information and make changes into their life. And sometimes you need to start where you always need to start where people are at, rather than use some algorithm or something that says, hey, you're 55, you're 6'3", so you should do X.
Yeah. And I think that's really where health coaches bring that strength in the uncovering, because quite often in a conversation with a client, they will tell you things that they haven't told their GP. They will tell you they've gone to their GP. This was a friend. She was told to have a DEXA for her bones because she was in that age group. And when I asked her about it, she said, "Oh, I had one years ago. My doctor keeps telling me to do it, but I had one years ago and it was bad. So it's just going to be bad." And that was her barrier that she already knew. And I said, "But you can do things about it if it is bad." She was like, "Oh, I didn't think you could do anything about it." So rather than say to her doctor, "Why do I have to have one? I know it's going to be bad," and have that conversation, the doctor was just saying, "Now, don't forget to have that scan." And she was going, "Yes, I know." And she was leaving with this belief, doesn't matter, it's going to be bad and I can't do anything about it. So health coaches discover those little nuances, those little tiny barriers that are in fact huge. And that's where the personalisation comes in.
Absolutely. And that's a really good example because your friend will sort of know that they've been sent for tests before and the test, whenever my doctor asks me whether I should do something else, which is investigative like that, I say, will it make a difference to what I do about it?
Yeah.
And a whole heap of time, well, in my doctor, not so much, but a whole heap of time across the health system, the answer is no. Okay, so you've got a sore back. Let's do an X-ray. Okay, what if the X-ray says this? What should I do? Well, do X. If the X-ray doesn't say that, what should I do? Do X. So there's no point doing the X-ray. But knowing that an intervention is available is actually incredibly important. So also working out function. What is it you want to do? Again, health coaches are much better at this than GPs can be with the limited time they have. So, you've got, if there's knee pain, okay, can you live with it? Can you manage it? Well, yeah, but I want to be able to get the dog's ball out from under the couch. Oh, okay, well, if that's the issue, then what we can do is get a stick with a piece of, sticky tape on it, a bit of gaffer tape on the end, and we can get the ball out. Oh, okay, that'll save me a knee reconstruction. Those are the type of things where it's a fairly extreme example, but what is it you want to do? So instead of looking at pathology and saying, okay, you've got this issue with your spine, we should fix it. Say, well, what is this thing doing to stop you doing what you want to do? What is it you want to do that you can't? And are there better ways to do that? Because, we do too much surgery in Australia. We, again, coming back to that fee for service, that demand from patients saying, I just want it fixed. Like having surgery is, seems a lot quicker and easier than, diet and exercise. But you get better results if you look after the underlying issues with health. And that information is really, really important. Well, okay, if I get a DEXA scan, what happens? I hear my bones are thinking, oh, so basically what your friend was hearing, oh, here's a way to increase my anxiety. Not, here's something which will help me manage a condition which can be managed.
Yeah.
And dealing with anxiety, dealing with, I think, my view of vegetables are, boiled Brussels sprouts. Not that there's anything wrong with that, but, have you thought about X? Well, if you are vegetarian, here are the ways you need to get your iron and your protein.
Yeah.
There are plenty of ways you can, with a bit of inquiry, a bit of back and forth and bringing that knowledge in, you can get to something which will help people.
And you raised a really good point, which is when you talk to people about what they want in the future. And in health coaching, that's central to any conversation that we have. It would be, who do you want to be in the next 5 years? And they'll say, I want to be a grandparent who can get down on the floor and get back up again. So everything that you do is actually about helping this person work towards, being able to get up and down off the floor, whether that's their weight, whether that's their mobility, whether that's anything in their life. And I think in healthcare, we're so focused on, the pathology or the outcome, we forget to connect it to the things that matter. This will get you back into your garden. This will mean that you can stay in your home for longer. This means that you'll be able to go to that family thing that's interstate that you haven't been able to go to because your COPD is so poorly managed. If we can teach health professionals to connect to the things that matter to the client, they don't care about being able to walk 10 meters, but they do care about what that means for them. If they can walk 10 meters, they can get back up and down off the floor. You won't have to call the ambulance every time you fall over. You'll be able to get up yourself.
Yeah, and for people a bit younger, it's a different thing. I want to be able to play kick to kick with my daughter in the park. I want to be able to throw a baseball. There'll be a whole range of things that people want to do, and you can build function for that thing. And health coaches can inquire around that. Say, okay, so is travel important to you? What are your hobbies? What is it you'd like doing? What's fun for you? And for a lot of people who we see using health coaching type services, it's around managing transitions in life. It's, I'm now coping with the psychological issues that come from, a job or a new baby or, my parents getting older or my kid dealing with, ADHD or a whole range of things where the answers aren't immediately obvious, but you can work towards them. You can sort of say, okay, so if we want to be a bit healthier, why do you want to be healthier? So I often talk about healthcare being a tool. It's not an outcome. If I had an X-ray and everything was perfect on my X-ray and my blood tests were all sensational, that'd be great. But that's not a good aim for me. Having a cholesterol level of X is not where I want to be. I don't care. What I care about is both can I protect myself from bad things happening, but also can I do the good things? If I love eating, okay, well, what do we do to make sure you can eat this rich food that you love? How can we balance that? How can we get you the veggies, or how can we sort of make sure that if you enjoy a drink, get the benefits of that socializing or that feeling that you get from doing something that's fun without the harmful stuff. And there's all sorts of examples you can use where like we do like doing things which are bad for us. And if health coaches say you may never do anything that's fun, it's not a great business model. But it's okay, what is it that's fun for you and how can we balance that? And again, coming back to sort of that sort of algorithm that sort of you shouldn't smoke or you shouldn't do this. For a lot of people, they can say, yeah, but I kind of like that. So, okay, well, if you do like it and it's fun and it's something which brings you joy, what can we do to protect you from the harmful effects of that?
Yeah, exactly it. Now we have, as you said, there's a lot of health professionals who add health coaching to their toolkit. And I have noticed that the people who get employed by the government, by private insurance companies to deliver the health coaching programs are health professionals. They're usually nurses, dietitians, maybe exercise physiologists. And I guess there's two things with that. One is, will health coaches who are just health coaches, and I don't say just, but HCANZA, accredited health coaches, could they ever move into this space? Is my first question.
Yeah, look, the answer is yes, and I hope so. And then the next question around how do we make it happen?
Yeah.
So the why first. Sometimes it's about the funding model. I can get a dietitian paid for. I can get some exercise physiologist paid for. I can get someone who's qualified in what I think of as qualified, or the program guidelines think of as qualified. And no one's going to say to me, why have you employed this person and what's this HCANZ thing stand for? And if for us, for example, we can pay for an osteopath. And if the osteopath is providing services which might be health coaching, then we can pay for some of that in certain circumstances with a big asterisk next to it. But Then, for people who have got a CANS qualification and that alone, then we don't have the mechanisms to pay for that as an individual service at the moment. Now, partly it's numbers. Like it costs us a lot of money to be able to set up all our processes to pay for things. And if there are only a couple of hundred people or a few hundred people, then should we be spending a few $100,000 to change our systems? Is that what people want us to do? And that's that. And then you end up in a chicken and egg thing that, well, people don't become health coaches because the funding's not available. And I get that problem. It's a real problem, but it's a problem from our side as well in terms of the systems to automate payments.
Yeah.
So there's that practical side. Then there's the knowledge side. Who is a health coach? If I say, hey, Sharon, you should eat better and stop smoking, does that make me a health coach? And then, you'll be bristling and saying, oh, I've done this bloody course. It was really difficult. But, there's people who describe themselves as coaching in all sorts of ways. So, hi, I'm a spiritual guide. Here I do, breath work, which I love. Is that person a health coach? Well, obviously not, because they don't have that breadth, but it's getting people to understand what a health coach is, what the CANS qualifications actually allow someone to do, and the professional development, all of that stuff. That's actually fairly tricky, and I've been seriously impressed at how HCANZA are going around about that to make sure that more and more people know. You guys are doing a really good job with that, but it's a really hard job and it's a long, difficult. So, yeah, getting that knowledge. There's also the demand side. I don't want someone, do I want someone telling me what to do? I bristle and say, well, no, thanks. And then I think, well, yeah, actually, I would like some help with this. And, a lot of your guys have got, private clients, generally better off people who are looking to be able to get as healthy as possible with whatever mechanism they've found a health coach. They see the value, they're prepared to pay out of their own pocket to do it. And, if you're lucky, they tell their friends. But that's not available to everyone, and arguably not available to people who would get the most benefit out of it. So what can we do to tack it on to something like social prescribing? Both Linda from HCANZA and I are on the board of the Australian Self-Care Alliance, and we've got a program we want to develop around doing some testing of people for heart health. And, if you reach certain thresholds, have half a dozen health coaching sessions paid for. That's the type of thing where, okay, it's a legitimacy. We can see what the results look like. We can actually demonstrate the value. So it's a long road and it's a hard road. And partly it's incumbents protecting their patch. Partly it's trying to explain what it is you do. Part of it is actually trying to generate the demand. But yeah, it's when I first sort of came across the health coaching thing, I thought, this is great, and this is where we need to be going. What can I do in my position to do it, to help? And I rang around some of my members and spoke to them about it. Some of the health funds, and then all these health coaches who work for health funds started popping up. And so, we've been able to share some of that information among more health funds, being able to sort of talk about health coaching a bit more. But again, coming back to how do I get some money out? How do I demonstrate the value? How do I make sure that the economic case is strong?
Yeah, I completely get it. You know, like you said, return on investment. It's got to be worth its while, and we have some more work to do in being able to prove that as a profession. There's
And you've got to have the money free to invest. And this is where, the public system does really badly on prevention. There are a number of things where we think the return on investment may be pretty good. There's just not the money available. So, one of the real challenges for someone in my role is to try to stop spending money on crap which doesn't work so you can actually invest money in stuff that does work.
Yes, I can imagine that would be have its own challenges.
Absolutely. Because, whenever we talk about something like low value care, which I mentioned earlier, somebody's making money out of it. So trying to explain to someone, hey, what you're doing is silly and you should stop and, destroy your own income it's a difficult thing to do.
It is a difficult thing to do. Now, I do want to assure you that someone who is a HCANZA accredited health coach would never tell you what to do.
Yeah,
What
yeah,
do
and
you want
that's
to do? And what have you been told to do by your medical team? And what are you struggling with? And how do you feel about it? So rest assured, there would be no telling in a proper health coaching role. And that also brings me back to, that HCANZA has got a set of competencies, and, that there's this high standard that accredited health coaches have to meet. And really, until we get a standardization across the board, until we get anyone employed as a health coach, particularly by government or private health insurance, meeting that standard, we aren't going to have that message out there that health coaches must be, accredited by HCANZA. They can't be green juice, yoga, breathwork enthusiasts who just want to call themselves health coaches. They need to have proper training.
absolutely. And, this is an unregulated space. I can call myself a health coach. And, I did a little Google search yesterday to see who calls themselves a health coach or coach and health in the same thing. And not many of them were HCANZA members. And that's tricky. And coaching is valuable in a whole range of ways. For whether it's a juice diet or breath work or yoga, all of which can add to the thing. But that set of competencies, that broad set of competencies, that approach of health coaching and the accreditation and the continuing development, professional development stuff that you guys do, that's incredibly valuable. And it's getting and demonstrating its value is tricky. And I know you're doing a lot of work on that. Some of the stuff that seems to be happening in New Zealand, I've been watching with a lot of interest. And they've got quite a different health system. But yeah, look, it is important to be able to keep promoting, okay, well, health coaching is a thing. It's not, it's something where there is a bar and people should be over it, not say, hey, I do coaching and get nowhere near that bar.
Yeah. And even, dietitians call themselves coaches and they haven't done coaching. And
Yes.
and other professionals will say, oh, I do coaching. And I guess, part of my personal soapbox is to say, no, you need to have studied coaching to call yourself a coach. And I would love to see, the diabetes online coaches and the Get Healthy services only use HCANZA coaches, because then we would know that they were going to deliver this level of coaching where there is no advice giving. There is no telling people what to do. It is just finding out the barriers, helping them to get motivated and setting them up for success.
Yeah, and there are only a few hundred of you at this point, and there need to be thousands to do it well. And you're working pretty hard on that. That issue around everyone thinks they give good advice. Uh, there's something that is incredibly valuable if you've actually got the the structure, the processes of inquiry that the HCANZA course does have, it means you're going to be better at it. So being able to demonstrate that, being able to have enough people so you can actually hire a HCANZ qualified person, that that's sort of where the next step needs to come from the profession, which you guys are doing a great job at.
Yeah. Still some work to do, Ben, as you have said, and as we know.
Absolutely. Like it's a tough thing. Like it's one of those services which, when done well, is incredibly valuable. When it's done, not so well, it can still be valuable. Sometimes it can be harmful. But the thing I love about health coaching, the way you guys do it, is it is about inquiry. It is about working out what those barriers. It's about an individual, not a system. It's an individual fitting into a system, but it's much more likely to work because you actually do that inquiry rather than say, "Hey, you should, stop smoking."
So no health coaching as part of the private health insurance as individual providers yet, but we can continue to work on it. And you've given us a lot to think about in terms of, why maybe where there aren't enough of this service and where we need to go.
Absolutely. And one of the pieces of advice I think I gave at your conference, if not on stage, then to plenty of individuals, is toot your own horn. Demonstrate, instead of thinking, I'm really good at what I do. Tell people, write it down, actually demonstrate, hey, here are some of the results we can get. Here's how the approach differs from X. This is why we work with GPs and work within a health system. But we add to it and we improve your results. So there's that sort of, there's that mixture of differentiating, integrating, and most importantly, demonstrating. Please don't be shy. Australians need you guys to be loud and proud.
So our take-home message is toot our own horns.
Absolutely. And keep doing the hard work you're doing. Keep demonstrating, keep writing things down, keep doing that work to actually demonstrate. If you guys say you're great, that's nice, but actually, hey, we are great, here are the results we get. That's where we get some real change.
Yeah. I think we both agree that health coaches have this integral role that they could be playing in preventative health, and that there could be huge return on investment. And there's just a few we need to do in the meantime.
Yeah, look, it's prevention and management. Most people are going to be living with chronic disease or some health condition or something which may lead to a chronic disease. So a lot of things, you can't fix, you can manage. Like whether that's, hey, you've got a bit of pain, suck it up, or, your diet's improving, but let's start looking at some of the psychological effects of why you eat a bar of chocolate at night or whatever it happens to be. And that's where that individual approach can come in. Manage what you can manage, change what you can change, and help people be the best, get the best health they can in their circumstances.
Yeah, absolutely. It's about living, it's about quality of life, and it's about, personalising those recommendations so that actually make sense to you, meet your priorities. And most of all, people need to be invested in their own health, and, health coaches can do that.
And being told what to do doesn't help with that investment. Having a coach to coach you to do it, it's a bit where we can make a real difference.
Yeah, absolutely. Thank you for all of your wisdom, Ben. Thank you for sharing all of the ins and outs of private health, and what all the decisions, the decision tree, and some of the things that influence what gets chosen and why it gets chosen. And I think there's a lot of hope on the horizon for the healthcare industry as a whole. It might not all be funded by Medicare, but I'm sure that, as in the different ways people start taking charge of their own health and we all start working together. And I know health coaches are going to be more and more part of that. Things will change.
Absolutely. People want to change. People need some help. If we sort of say individuals have to do it all by themselves, it's not going to work. And that's where health coaching can help individuals get their best results. And we need to find as many different ways to fund that as possible.
Yeah, I agree. All right. Thanks, Ben. And if you're listening and you've enjoyed this episode, please feel free to share it. And if you're a health coach who's not accredited with HCANZA, hop onto the HCANZA website because you heard it from Ben. You need to be accredited with HCANZA if you want to be credible. Thanks.
Thanks for listening to Health Coaching Pact. If you enjoyed today's conversation, please subscribe, share, and leave us a review. It helps us support more coaches just like you. Stay connected with HCANZA on social media, Facebook, LinkedIn, and in our YouTube channel. If you want to learn more about membership and resources, go to our website www.accanza.org. Until next time, keep learning, keep growing, and keep making an impact.